So the deep cervical fascia. The deep cervical fascia is also known as the fascia coli, the area which are divided of deep cervical fascia or the face, except the parotid and the anterior abdominal wall. As the parotid is enclosed in the investing layer of deep cervical fascia, any parotid swelling will causes the pain at the parotid by the great auricular nerve. And modifications of deep cervical fascias are the investing layer, pretracheal, prevertebral fascia. These are together form the carotid sheath. Next, we have this buccopharyngeal fascia, which is an extension of the pretracheal fascia and pharyngobasilar fascia. So, transverse section of neck. If we take this transverse section of neck, so here we have the anterior we have sternocleidomastoid muscle, posterior we have this trapezius, and vertebral column is present, and we have this investing layer. So the investing layer encloses this trapezium and also the sternocleidomastoid muscle. Along the vertebral column, we have this prevertebral layer. And around the trachea, we have the pretracheal layer. It consists of a two-layer visceral and also the muscular layer. Muscular layer encloses the strap muscles, and the visceral layer encloses the thyroid gland, and it forms the false capsule of the thyroid gland. All these layer, that is investing layer, prevertebral layer, and the pretracheal layer, will give rise to the carotid sheath. So the prevertebral fascia will get extension into the axilla as a axillary sheath, which encloses the axillary vessels and also the brachial plexus. The carotid sheath. So this is the carotid sheath. On the upper surface of carotid sheath, this cranial nerve 11 and 12 will get exit, and here we have this common carotid artery. It will get bifurcated into external carotid artery and the internal carotid artery. External carotid artery is not the content of the carotid sheath. Next, we have this 10th nerve, that is the vagus nerve, and followed by the internal jugular vein. So artery, nerve, and vein. So this internal carotid artery and the internal jugular vein are helpful for the vasculogenesis, whereas external carotid artery, it is for the angiogenesis. We see this anteriorly, posterior, lateral, and medial. On the anterior part of carotid sheath, we have this ansa cervicalis, which is adherent to the anterior wall, and posteriorly we have this sympathetic chain, and the contents are the arteries and nerve and the vein is present. If you see, this is the vertebrae. On the vertebrae or transverse process of vertebrae, we have this scalenus anterior, scalenus medius, and scalenus posterior. In front of scalenus anterior, we have the phrenic nerve. In between the scalenus anterior and also scalenus medius, we have this brachial plexus. So in front of the prevertebral fascia, we have esophagus and also the trachea. In tracheoesophageal group, we have this recurrent laryngeal nerve, and this is the carotid sheath. Anterior layer we have this ansa cervicalis, posterior we have the sympathetic chain, and the content it is a vagus nerve. If we see the transverse section image, this is the vertebra, this is a sternocleidomastoid muscle and trapezius. This is enclosed by the investing layer, and this is the vertebra, and this is a prevertebral layer. In the prevertebral layer, we have scalenus anterior, scalenus medius, scalenus posterior. So in front of the scalenus anterior, we have this phrenic nerve. In between this, we have this brachial plexus is present, and next, this is the thyroid, and this is esophagus and trachea, prevertebral fascia, where it encloses pretracheal fascia, where it encloses the trachea. So in tracheoesophageal group, we have this recurrent laryngeal nerve. If we take the sagittal section, with head turned to a side, we can see this green color. It is the investing layer. It will enclose as the submandibular gland and it extends till the suprasternal space. And posterior we have this pretracheal fascia, which enclose pretracheal fascia encloses the thyroid gland. We know now. Visceral layer of the pretracheal fascia which encloses the thyroid gland, and it merges with the fibrous pericardium at the level of T4. From thyroid to cricoid, we have this suspensory ligament of the belly is present. Next, posterior view of sagittal section. If we take a posterior view, so we have this pharynx, and these are the vertebrae. To the pharynx, this is a pharyngobasilar fascia is present, and next this is the buccopharyngeal fascia, which will covers the pharynx, pharyngobasilar fascia and the buccopharyngeal fascia, and this is the prevertebral layer is present, and the area between the buccopharyngeal fascia and the prevertebral layer, it is considered as a dead space, and this is the alar fascia, which is the anterior layer of the prevertebral fascia is the alar fascia. It will merges the with the buccopharyngeal fascia between the C6 to T4, it get merges, and the area between this is it is the dead space, and next prevertebral space will extend till the T1, and this is the vertebrae, and this is a dangerous area of the danger space. If the infection present at this area will get spreads into the posterior mediastinum, it will compresses the trachea and esophagus, leading to the dyspnea and dysphagia. The things which are enclosed by the investing layer, it encloses the it is rule of two, it encloses two muscles, sternocleidomastoid master and trapezius, encloses two glands, parotid and submandibular, two spaces, that is suprasternal space, supraclavicular space. Suprasternal space is also called as a burn space, two ligaments, stylomandibular and sphenomandibular ligament, and forms the two pulleys of the heads of two headed muscles, that is digastric and omohyoid muscles.